I am Dr. Heather Moore, owner of Total Performance Physical Therapy, and we are going to discuss a topic tonight that I help a lot of people with. It is shin splints, or my shin hurts. It's a very common reason that people come to see us here, and usually one of the things that right off the bat I want you to understand is that shin splints don't develop overnight. It's not something that you're going to run with one day and all of a sudden feel and be like, oh my gosh, I have shin splints. Shin splints take a long time to develop, and usually what happens is it starts as either ankle pain, or you'll start to feel a little tenderness in your shin and you'll ignore it. And mile one it'll start to hurt, or it starts to hurt walking, and you'll kind of ignore it because it'll go away. Most shin splints start off with pain in the shin that goes away. So if you are a runner, or you do aerobic activity or any sort of impact activity, and you're noticing pain in your shins and you're like, oh thank gosh, like I just got to get through this and it goes away, or maybe it's right when you start out and then it goes away. It is not something that's going to stay away. It's actually going to come back with a vengeance. So you really want to make sure that you are addressing it when it happens. It's much less time involved. It's much less costly to you if you actually take the time to eliminate it when you initially start to feel it. In fact, most pain that we treat and most pain that people come in with is very much a pain that started off as, oh, it hurt, going up and down the steps, or this or that, or small increments of time it would hurt, and then it would go away. So it's very important that when you find that there's a pain, and there's a consistent pain, of course, if your shins hurt one day and then never hurt again, you probably don't have shin splints, you probably don't have an injury, just something happened that day that your shins hurt. But most people, as they come in and they talk about their shins hurting and why their shins are hurting, start with, I started to run, or I started to do this, and it started either hurting right away and then it would go away, or would come on at a certain period of time or a certain mileage, but then it would go right away and it was totally fine. It's going to get to a point where it's not going to be fine. It's going to get to a point where it will stop you. So you have to be aware of the fact that just because you're able to ignore it today, you won't be able to ignore it tomorrow. And unfortunately, when you can't ignore it anymore, you are done with your running. You are done with your aerobic activity. It's not going to allow you to continue. It's going to be extremely painful, and it's not something that you can come in and say, okay, I'm going to give you 2 visits of physical therapy and then I'm going to be done, and it's going to be all better. It's going to be something that's going to take a while to actually eliminate. So again, it's one of those things that you need to address right away, because then it does only take a couple visits or a couple little things that you can do to eliminate that pain. So really address pain as you feel it come on. And I know there's a lot of information out there, and there's unfortunately a lot of misinformation out there on how you should treat them, or what you should do or not, or should you ice or not ice, or heat, or and people get so wrapped up they wind up being paralyzed and not knowing what to do, because this person who sounds really credible says this, and this person who says really credible says, no, don't ice, and ice is bad for you, and this person says heat, and no, heat's bad for you, and why most people have paralyzation of information because there's so much out there, and everything contradicts one another, and everything contradicts exactly what they're trying to research. So they wind up doing nothing, because unfortunately what happens is there's too much information out there. So we're going to go over some reasons why your shins hurt and what happens when you have shin splints. We're going to keep it a little bit basics, because it is a kind of a complex issue. But what I can tell you is, if your shin hurts and you just treat your shin, it's not going to get better. It may get better for a day or two, but it's not going to solve the problem. And one of the things that we focus on here, and that you always really have to focus on, is treating the problem. It's treating the whole body. It's never usually just an issue right at the shin. When you have a shoulder issue, it's generally never just a shoulder issue. You got to look at the neck. You have to look all up and down. And a lot of people have relayed frustration and been angry or upset because they've tried to get treatment, or they've tried some things, and they've worked on the shins, and they've had the shins worked on and dug out and all this stuff, and it lasts for a little bit of time, maybe a month, maybe 2 months, maybe a year, but it comes right back. So you really need to be aware that if all you're doing is treating your shins and you have shin pain, it is going to fail. It will come back. It may never go away. you may always have some residual issues. So it's important to note that if you are looking to eliminate your shin pain, you've got to actually go higher up. And where you have to go? You got to go up to your hips. So a lot of times when you're looking at shin splints, it's because of a failure actually at your hips that's causing some things to happen at your feet and is causing some issues in your shins. So one of the things that you can do is you actually can strengthen what we call your glute medius. And your glute medius is just the muscle in your hips that's going to allow a little bit more stabilization on your foot. So all you need to do for that is you're just going to do what we call hip hikes. So this leg should stay still. You're not going up and down with this leg. It's not moving, all right? You just want to go nice and easy, up and down just like this, okay? You're hiking your hip slowly, all right? It's not fast, all right? If you need to touch down in between each one, you can. Otherwise, you're just going to go up and down, nice and slow. Now, if you're like, I've done this before and it doesn't work, you probably are needing to move on to a little bit more professional treatment. So if you have shin splints and want to come in for a free consultation, we certainly will take a look at you. All you have to do is call 215-997-9898. But now back to where we were. So if you haven't worked on your hip strengthening, that's one of the things that's going to be imperative to causing or eliminating that shin pain. Another thing you do want to consider is your running shoes. If it's a running or you're getting shin pain while you're doing impact activity, how old are your shoes? Are your shoes properly fit for your foot? Say that a couple times fast. It is important, and I know people like to bulk and try and get around good running shoes, but if you're doing impact activity, you're doing running, having a good supportive shoe or having a good shock absorption shoe is very important, and depending on how your foot is, will depend on what type of shoe you need. So if you wind up getting shin pain, really make sure that one, your shoes don't have a ton of miles on them, and you're able to actually continue to run on them. And then two, that you have the right shoe for your foot. So getting properly fit does make a difference. The next thing you want to do is you want to make sure that you are balanced kind of in your muscles. So we did a little bit with the hips. Now what you want to do is you can do some toe taps. Now, if you are in advanced stages of shin splints, you're going to have a very tough time doing this. It is going to be painful. So you may not want to do this, all right? But you want to eventually work on actually strengthening the shins. A lot of times people confuse shin splints with, an overuse, which they are, but at the same time, it's a significantly weaker muscle than what your gastroc is in the back. So strengthening it and just sitting here doing toe taps is going to help. A lot of times, we have marathon runners in here that get tired after a minute of toe tapping. They can run 26 miles, but ask them to tap their toe for a minute and it's really exhausting. So that's another issue. That's another exercise you can do at home for that. And the final thing that I'm going to show you is just stretching out the front of that calf. So, the front of that shin. The best way to do this is without shoes, all right? But all you're going to do is tuck your toes under. All right, you may need to bend down. You're going to feel a stretch in through here, possibly into your shin. If you start to feel a stretch in through here, that's fine. Hold the stretch. Hold the stretch for 30 seconds and repeat it 6 times. All right, if you can get the stretch to go all the way up to your your shin, even better. Don't overstretch. Don't push your foot so far because you think you have to have a stretch in that shin. If the stretch starts in your toes and that's where you can feel it, start there. Do that a couple times a day. That one you can sit at your desk and put your foot underneath and stretch out your shin. You can also foam roll your shin. It is important that your roller have spikes on it. I know a lot of people have the stick, and that is not something that's going to break up any sort of tissue or anything going on in that shin. So if you have a roller with spikes on it or a bar that has spikes on it, that's going to help to break up some of that tissue in the leg that is hurting. But most importantly, you've got to look at the foot, you've got to look at the knee, you've got to look at the hip. When you are talking about shin splints, it is not a failure just at your shin, it's a failure all over the place. If you are experiencing shin pain and you want to come in for a free consultation, all you have to do is call our office at 215-997-9898, or you can click the link and it will take you to a page where you just fill out your information and we'll give you a call to set that up. Thanks and have a good night.